Well, good morning, everyone. It is an honor and a privilege for me to be with you this morning, to have been invited by Dr. Hildreth, thank you, and the Board of Trustees of Meharry Medical College to address all of you today. It is energizing for me to know that seated in this room are the future leaders of healthcare. You will indeed help to shape the future of healthcare delivery for all of us. Above anything else I say today, I'd like to express my thanks to each of you for committing your time, your talent, and yes, your passion to the pursuit of improving the health of people around the country and indeed around the world. Whether it be through the practice of medicine or dentistry or research of the biomedical sciences or hospital administration. The path you've chosen is noble and will make a difference. I'd also like to thank you for choosing to study at Meharry. Meharry is dedicated to reducing healthcare disparities and ensuring that people across our nation, regardless of where they live or who they are, have access to the care and services they need. Meharry is an important national treasure. And as a native Nashvilleian, it is important that it's here. As Dr. Hildreth mentioned, my name is Bill Carpenter. I'm the Chairman and Chief Executive Officer at LifePoint Health. LifePoint Health is a leading investor-owned healthcare company that owns and operates hospitals, physician practices, post-acute services, and outpatient centers in more than 70 communities in 22 states across the country. As a fellow healthcare professional and leader, what I hope to impress upon you today is that you are already a leader because you have chosen this honorable profession. When you graduate, your leadership will be enhanced by your title, doctor. You will immediately be trusted by people who will have relationships with you that are unique with respect to any other profession I know. With your leadership and your title comes tremendous responsibility. Don't take lightly the weight of your voice and your presence. For those of you who will be delivering patient care, both the words you say and your demeanor are the most important things in your patient's and his or her family's world. Communication is very important. We use a lot of big words in healthcare. It sets us apart because of what we know, but it can also set us apart from our patients. So remember, you're helping people. You must meet them where they are and understand that often they are overwhelmed by the world that you live in. I also hope to impress on you today that particularly in today's healthcare environment, you have a tremendous opportunity to employ your leadership to transform healthcare delivery. The healthcare industry today is unlike anything I've ever seen. I'm saddened by the politicizing of healthcare that's happening in Washington, D.C. and around the country in many state capitals today. Unfortunately, these politics often seem to be at the expense of the poor and the powerless. As leaders, we must be advocates for these people. I believe that's why you're here, to care for people. And I implore you to be there for all people, wherever they are, whether in rural areas or in the inner city. And I encourage you that you have a right to advocate to be paid fairly for what you do. We can't let politics take away our ability to be there for providing care for people who need us, including the poor and the powerless. Congress needs to work in regular order. They need to work in a bipartisan way to improve or reform health care. Your voice will matter in these discussions as they continue. Outside the political sphere, healthcare is an industry that more than ever before is ready to push the lines of innovation and to respond to the world as it is evolving. Think about how much the world has changed over the past decade. Everything that we do online. Banking, shopping, making a dinner reservation, ordering a car to come pick us up, finding a home service provider. Heck, did you even know that you can take a picture online, submit it to your insurance company, and file a claim on an app? Businesses across all industries are adapting and responding to their consumers in tangible ways. And the healthcare industry is evolving and must evolve too. Healthcare has changed a lot in the past few years. We've seen innovation in meaningful ways and signs of transformation in the advancement of technologies that allow services to be provided in the outpatient setting versus the inpatient setting. Telemedicine strategies that leverage technology in new ways that allow people to access healthcare providers outside of the traditional brick and mortar delivery model. Consumerism strategies in which we're recognizing that our patients are more than patients, they're consumers who make choices. At LifePoint, this means focusing on access and engagement and helping our providers understand that perception and reputation and engagement of experience matters. And population health strategies focused on better organizing the healthcare delivery system by aligning previously disconnected providers, hospitals, payers in clinically integrated networks, focusing on improving clinical outcomes, reducing the cost of care, and maximizing the value received by the patient, and ultimately, I hope, creating healthier communities. One important frontier for healthcare has got to be the interoperability of electronic medical records. We need to operate in a plug-and-play way to improve patient safety and efficiency in the future. And this is critical. This is something that we're going to be seeing a lot more of over the next several years. We still have miles to go. There are many who would say, me among them, that other industries are moving faster than we are in healthcare, but we're making progress. When I think about healthcare transformation, I think of how leaders and innovators are working together to break down barriers, to build bridges, and collaborate in meaningful ways. This is exactly what I hope you will do. As you begin this academic year, I encourage you to think about how you, as healthcare leaders, play a role in the future of our industry. Begin by listening. Learn from one another. Engage in healthy dialogue and debate. And don't shy away from new ideas. This is what great leaders do in the time of change. They embrace it, they have discussions, they work to find new solutions that address shared goals. In this case, our common focus should be on providing high-quality care, affordable care to the communities that we serve, and creating positive experiences for people in what is often their most vulnerable time of need. The future of healthcare is largely unknown today. I hope you'll use your platform as a healthcare leader to drive positive change. Thank you for allowing me to spend a few minutes with you this morning. Best of luck in your upcoming studies, and I look forward to hearing and learning of the great accomplishments that come from the graduates of Meharry Medical College. Thank you for having me.